and hope you can share some of your experiences in your countries with us during our discussions. So we are going to discuss about what the PHC is and what is important for, and the principles, also the main components of the primary health care system in different countries. Okay, actually the primary health care is an approach to promote people's health by their own efforts and their knowledge. They should share what they think about their health and what are their needs, and the main services they gave the people in PHC system are the essential services and the essential needs of those. So it should be accessible for everyone, and also the people can pay for it. So the accessibility and the affordability are the most important aspects of the primary healthcare systems everywhere. It is first outlined in 1978 by WHO and the World Health Organization actually, and the main basis and the main principles are initiated at that time. And it is one of the important fundamentals of human rights everywhere, and now every country tries to put more energy, strategies and programs to improve their primary health care system. The primary health care actually is the first level of contact between people and the healthcare system everywhere, because people need what they need about the basics of health. They will go to healthcare centers for acquiring their the service they need actually. And as I told, mainly the main services, essential services about the people's health are provided by healthcare centers. And it is usually in public system, not private. So the main services people need, the essential problems they have with their health, they will go to public health centers to access for the services there according to their needs. The PHC aims to empower individuals and all the communities to take charge, as I told, about their own health, and they don't want people to depend on private sector or to specialized hospitals and specialized care. So the main purpose is that people can access for the essential needs in very low price and very cost-effective way. So PHC is not just about the treating people when they need. It is about health promotion. It is about prevention mainly, and as I told, about the empowering people. How we can empower people about their health by giving them the knowledge they need and to prevent them from the prevalent diseases. The principles of PHC system everywhere are to ensure that health care are given to people effectively and in a way that it is sustainable and accessible, and also the main principles are rooted from the Alma-Ata Declaration from the World Health Organization in 1978, as I mentioned before. Now we are going to explain about the principles, the main principles of primary healthcare systems everywhere. One of the main principles of the healthcare systems is equity. What do we mean by equity in health? It is meant that when people need some services everywhere, they can have the access to that service. Regarding the aspects of money or gender or race or everything such, or for example socioeconomic level. So the equity in health means this, and it is actually prioritizing the needs of marginalized or under-deserved populations, those who have, those are not so rich, for example, and don't have enough money, can get what they need about their health. And to reduce health disparities everywhere, that should be one of the main health policies in every healthcare system in different countries. So, for example, providing mobile clinics, mobile units, dental units for villages or rural areas is one of the very good points that the PHC system think about to give access for the people, for those people who don't have any access to private dental care, for example. Another is to community participation. What do we mean by community participation? It means that communities should have actively participated in different healthcare centers to, for example, for their health, for their family health, children's health, to maintain healthcare system and also to ensure that services meets the needs of all the people everywhere in every country. So the providers and the population should be in close contact together. So this is what we mean by the community participation. It doesn't mean that people should be passive for their health. They should be active, they should get knowledge, they should know where to get the good services for their health or something like that. One of the good examples of this is to train some local people to educate mothers for the care of their child. So these local people can go to their communities and give the information they gained, they trained for this, and their family's health should be improved by this. One of the other principles of health, as I mentioned before, is the accessibility of the services. It means, do we mean by this that everywhere in every country should have a clinic or hospital or a center? What do we mean by this? Can you give me an example, please?
Can you ask the question?
I would like to know what is the accessibility of the health care. What do we mean by this? Do we mean by this that everywhere, in every village, every city, we should have a clinic or a hospital or something like that?
It's important that in every village and city it will be present hospital, clinics. Maybe there are some emergencies which the poor peoples, they have financial issues. So some hospitals and clinics should be free for the poor people. So the health care should be that poor people can take it. So in my opinion, I can say that health care should be present in every places.
Okay, thank you. Any other about the access to health? As she told us, it is important that each center is located in a place that people can easily access to that. But this is not exactly mean that in everywhere, every place, every city, we should have a hospital, for example. No. People should have access in a proper way, in a good distance from their homes, and also in a way that it is affordable for them. So this is the example, the good explanation for this, and it is important that people have the facilities, especially when they are in emergency for their health, as she told me. So this is should be bear in mind. And the appropriate technology. One of the most important principles of primary health care is that this care should be in line with technology, and the technology should be in intermediate, not very high level and not very low level. So the intermediate level is considered as proper level for every, actually for private care. I don't mean the specialized care. Of course, in specialized care, for example, we need more high-tech technology for scanning, for PET scan, or something like that. But for primary care, such as vaccination, mother's care, child care, educating for nutrition and health, and these doesn't need, and it is important to know that these should be in line with the proper level of the technology, not very high tech and not very low, of course. For example, as you see here in the slides, the using oral rehydration salts to treat diarrhea in children instead of requiring advanced hospital equipment, injection, for example. So with a very simple thing that is oral rehydration, with simple solutions that mothers can make it in home, we can save a child of diarrhea. It is actually not important to bring him or her to a hospital to have injected drugs, for example. Another principle is the intersectoral collaboration. You know that health is a multifactorial thing, and it is a complex phenomenon. So it depends on people's health, depends on different factors. For example, is it just the responsibility of healthcare system to give proper knowledge to people, or to provide them with health services? Of course, the health services mainly are provided by healthcare system, but the educational system, the sports ministry, these are also important, and welfare system in countries are important in providing health information for people and facilities for them and things like that. So not just the government, also private sector, also agriculture and education ministry, all of them should be collaboratively coordinate the programs for the health of people. For example, in the schools, if you want to give a health service or oral health education, for example, you have to be in collaboration with Ministry of Education, not just health. So all these sectors in government and and even NGOs or private sector can cooperate with the healthcare system to give them the proper facilities for health of the people. Okay. What about the prevention and health promotion? Of course, this is one of the main aspects of primary healthcare systems everywhere. For example, children's vaccination everywhere, in every country, prevent which kind of
Polio drops.
diseases,
Polio drops.
for example,
Yellow
any other for vaccination, examples for vaccination of children, hepatitis B, measles, all of it. So the contagious diseases mainly are prevented by this. And also to prevent for the malaria disease, as you know, in every country that have this problem, they try to educate people to immunize and also to give them the facilities they need to prevention. Okay, the care should be comprehensive. What do we mean by the comprehensive care? Hazem? Have counseling, for example, for different disease management, prevention, vaccination, and for minor injuries, they can have some managements. Okay, we want to know why PHC matters. What is the importance of PHC? What is important about the primary health care? Why should we
To
have?
get a good health,
Mhm.
to save from different diseases.
Yeah.
Like
So, as I told you, as I mentioned about the principles, these principles showed us the importance.
Yes.
As she told us, we want to prevent different diseases, we want to improve people's health and to maintain good health for our communities or people. Okay, so one other importance is that we want to prevent people to go to or to depend to specialized care. So if we can have the primary health care from the beginning of life, for example, for our children, for the pregnant women, then we can prevent them from the complicated health problems. So we prevent the complications, we prevent our people to go to hospitals and to need complex and complicated care. So it is focusing mainly on prevention and on early detection and diagnosis of different diseases and early management of those diseases. Okay, these are, as you see, the main activities in healthcare systems, in primary healthcare. So as you see, we don't have any specialized or any complex care there. All of them are very essential, very fundamental. Like, for example, education, counseling, prevention, vaccination, mother and child care, okay? And basic laboratory services, not very complex ones, actually. And what we have in the last in this list is
refer.
what is referral?
hospitals.
To refer people from primary healthcare center
hospital.
to hospitals, for example, or to specialized people, specialized doctors, specialized care. What
For the
if they need
Yes.
for actually, okay? So these are the main core activities. Also, you can see in this slide to provide people with food supply and proper nutrition. And also you can see this to provide people with an adequate supply of safe water, clean water, sanitization. So these are the main things in different countries, the public health provide for their people in their PHC. These, as you see, are the basic requirements for a good PHC. Of course, everywhere may have a PHC system, but is the PHC system working good everywhere? Of course, it may or may not. How should we know? How can we assess why these things? Appropriateness, availability, accessibility, acceptability, affordability, adaptability, and accountability. These are the 8 A's. As you see these words, all of these start with the
Alphabet
A. Yeah, with alphabet A, and so these are the essential attributes of a PHC, good PHC in every country. And also we have 3 components, core components for PHC. These start with a C alphabet, C letter, and its comprehensiveness, coordination, and the continuity of care. I'm going to explain it in the following slides. Okay. What about the availability? As I told before, in every people who need health should have good access, and the primary care must be available for all people regarding what they are or what gender they have, or in which socio-economic group or class they are. So it should be qualitatively and quantitatively, the care. The care should be in high quality and in proper quantity for those people who need them. So it is when someone thinks of designing a healthcare system, it should think of proper staff, buildings, and also the services they should give to people according to their health. If services or supplies are unavailable, actually PHC cannot address the health of their people, the health promotion or maintenance of good health and prevention. So ensuring every, for example, rural place or every city has a good supply of proper water sanitization, vaccination, and these medication they need for their essential health primary. Another thing that I mentioned you before is the accessibility. I will pass it. And about the affordability, it means that people should not pay so much for what they about the fundamental needs of their health, and it is essential that high costs for services should be taught, of course, and it should be in a way that all the people can pay for it. For example, in PHC system, mainly checkups are free of charge everywhere in every country, and also especially for target groups, which these target groups are mainly children and pregnant women, mothers. You know that in different countries, in some places, some people don't accept the care from public system.
Yes.
They want to use their own medications, for example, or they have some thoughts, they have some beliefs that prevent them from
The diseases.
acquiring the good services, and they don't let, for example, their children to use vaccination. Do you have any experiences in this regard in your countries?
In my country, most of the parents don't give the polio drops to the children.
Why?
They
Where are you
think-
from?
I'm from Pakistan.
Pakistan. Okay.
So they think that they impact their mental health of the children. So most of these parents, they think like that we didn't should give the polio drops to the children. So they give away. So now our government do like that. They did give up like a security police. And those parents who just refuse this thing, that we didn't give the children polio drop, so they put some cases on their parents. So like that, I have a case in
So
the country.
it is very important, and this experience. Thank you for sharing this experience with us. It is very important that children can have access to main vaccination for contagious diseases. For example, polio disease is very contagious, and it has a very high impact, negative impact on children's health. All of their life they cannot walk.
But
So-
our countries like that, when the children got their increase their age and they have the polio diseases or many another conditions, so then they realize that we didn't give our children in the birth polio drops, so that's why we have like this condition. But we can't do anything on that spot,
Yeah.
so that's why.
So it is the responsibility of the government actually to prevent from these things, and maybe by force, maybe by police or something like that,
Yeah.
they should prevent their children to be disabled for their long time, for long life.
Yeah.
Another important aspect is the appropriateness. It means that care must be relevant to the specific health needs and conditions of the population. So using suitable methods, suitable strategies and suitable programs for different health problems of people in every country. And if the service or the care is not proper, actually it may magnify the problem or double the problem. So using, for example, proper and affordable, accessible care is very important in all healthcare systems. What about the adequacy? What do we mean by adequate health care service? By adequacy, mainly we think about the quality of care. So by adequate care, we mean the care should be quality, should have the quality, enough quality, proper quality for long-term health. And for example, a clinic offering both vaccination and the management of chronic diseases is called an adequate clinic for the health of the people, not just prevention. Prevention and also high quality, adequate treatments. Okay, do you have any questions till now?
No.
Okay. One of the main aspects is that when we need something, we can have it or we cannot have. The system should have the strategies or plans to give the access to their people. But if their people doesn't need something, the resources should be changed and the services should be changed according to people's need. So the system, the PHC healthcare system should adapt its different aspects, its services, its personnel, or even their centers to adapt with the people's needs. Okay. Sorry, what are you talking and discussing about? Will you please keep quiet? And on the accountability, we mean that PHC providers and PHC system must answer the people when they need something, or the communities they give their service, and also to ensure that every aspect they have problem about or they ask something about should be completely transparent, completely responsible. They ask people to have their own responsibility, but they should be responsible for their own duties, of course. And the services should be completely in a way that people can have them without any problem or problematic way. For example, regular community meetings to review the strategies, to review the clinic performance should be held in every community, in every center, to ensure a good health for all the people. Okay, we spoke about the comprehensiveness of care. We mentioned that prevention, treatment, and the training, and also referral should be all included in PHC system in a center. For example, offering parental, prenatal care, child and mother care, and also if today we need more about the care for geriatric or elderly patients. So all of them should be included, not one of them in one center, one in another center, one in another. Each of them included in one. And I should emphasize that I am talking about the primary care, not the specialized care. Of course, for the specialized care, we should refer the patients to higher levels. But for the primary, everything should be located in a place that people or communities can reach. And about the coordination, of course, the coordination is very important in every health sector, not just the primary health care, but for the primary health care, because it is very fundamental and very essential care for every people in communities. The coordination must be emphasized, actually. And for example, referring a patient with severe hypertension to a specialist while coordinating with a nutrition program to give the patient a proper diet or to control the hypertension of these patients, or for those who have uncontrolled diabetes, actually. And the continuity of the services are very important. It shouldn't be temporarily, it shouldn't be one in a time in this way, and people expect to have a continuous service in a way that is proper and when they need it.